from renal physiology. This is last but one. Another class I am having on Monday. That will be the over end of this unit. Okay. And today's competency, two competencies are there. One is innervation of urinary bladder, physiology of micturition, and its abnormalities. 7.7, it is cystometry and normal cystometrogram, its significances. If you go through the questions of different universities on renal physiology, particularly on micturition and cystometrogram, you will find these questions. Okay, in university exams as well as in internal assessment exams. So, you must learn these questions. What are these? The first three may come as long type of question, and micturition reflex, autonomic bladder, automatic bladder, atonic bladder, cystometrogram, they can be asked as short notes. Or some external type of questions can be there from these, covering these. Okay. So let us start. Okay. Urinary bladder. This is a sac-like structure, muscular and cylindrical, hollow. It is located in the pelvic cavity. It accumulates urine with concomitant rise in pressure. So gradually, because of accumulation of urine coming from kidney through ureters, so this will be ending ultimately into the bladder through the vesico-ureteric junctions. These junctions are at the base of the urinary bladder. So from there, it will both the ureters will enter and deliver its urine into the bladder. Okay, this urine comes through the ureter into bladder in a pulsatile manner. Okay, means spasmodic. There is spasm in the ureter, and the wall of the ureters are made up of smooth muscles. Okay, and the stimulus comes from, there are some special cells in calyces, major, minor calyces. From there, the impulse comes to the muscles of the ureter, and the rate of impulse is 1 per minute. 1 impulse per minute. So when the impulse comes, the ureters contracts. So it pushes the blood to the urine towards the bladder. Okay. Then the main function of the urinary bladder is to accumulate urine without much rise in pressure. Okay, it has a particular mechanism. Urine will enter, we'll find urine will enter, but pressure is not rising. After certain limit, thereafter pressure will rise. Then we will feel urge of urination in that phase. Okay, so when pressure is rising at the end, nearly 400 to 450, 500 ml of urine, when it is accumulated in the urinary bladder, then we'll feel like urination. Okay, then urge will develop in us. And we will try to, if the time and place is not suitable for urination, then we will contract it or we will control it with the help of some somatic nervous system, voluntary nervous system. Okay, we can resist urination for some time depending on the place. If we have to find a place, no? Suitable place, suitable time. So for that period up to certain, when it exceeds 700 ml, total urine content, the bladder when exceeds, then we are unable to control. Then there will be automatic urination. Okay, before that there will be tremendous pain. Okay, so tremendous pain, it is now uncontrollable. You have to find a place. Okay, so as I said, from the urinary bladder, urine comes by peristaltic movement of the ureters, and the stimulus for this comes from the kidney, that is from, there are major calyx, minor calyces, there are special cells in the calyces. From there the impulse is produced, one impulse per minute. Regurgitation, once it is entered in the, from ureter it is urine enters into the bladder, it doesn't come out. Though pressure is increased, will be increased, but it will not come out. Why? There is a flap at the junction, vesico-ureteric junction, there is a flap, and moreover this wall of the urinary bladder is thick, made up of detrusor muscle. Detrusor muscle. And suppose this is the thickness, and the ureters will enter obliquely into the bladder. So when bladder pressure rises, no, so it will compress, so no ureter can come out, or no urine can enter into the ureters. So backflow is not possible because of special junction there. So that's why when the kidney develops stone, so this can be misplaced for the kidney into the pelvis, and from the pelvis, if the size is not so big, then it may come out of the kidney and it may run along the ureters and lodged at the junction. So now what will happen? The urine will not be able to pass into the bladder, so there will be obstruction. So in that case, you will face a lot of pressure, lot of pain on this side because of obstruction of the ureters. And in this case, if the patient is studied by ultrasonography, you will find ureter is much dilated, pelvis is dilated, calyces are dilated. So this is called hydronephrosis. This condition is called hydronephrosis. There is accumulation of urine in the ureters, in the pelvis, calyceal system. Okay, so there will be, this is because of obstruction in the junction. This obstruction may be created by a stone. And let us study in brief physiological anatomy of the urinary bladder. So this is the whole bladder, and this is another part. This is urethra. Okay, so this is urethra. So, and this part is urinary bladder, and this bladder is made up of two parts. One is body, another part is, another part? Neck. So this part is neck. This part is the neck region. This part is the neck region. This to this. That is the funnel-shaped part of the urinary bladder is neck. Okay. From the neck, actually, urethra starts. So here is the starting of the urethra. So this is the urethra. It is for female bladder, it is a male bladder. So here is the urethra. So this part of urethra, this part starting from here to here, this part is, see, it has got anterior wall, posterior wall. Posterior wall, you will find a triangular area. This triangular area is called trigone. Okay, you can see clearly this trigon. This is the trigon. Okay, this is the triangular area, trigon. And the surface of this trigon is smooth. Whereas the rest of the part is not smooth. This is folded. And this folding is called what? In stomach also this folding is there. Huh? Rugae. R-U-G-A-E. Rugae. So here also you will get, if you see minutely, here you will find a lot of rugae. Why this rugae? To increase so that when it is distended, so that surface area can be increased. It can accommodate more urine. That's why this folding is there. Okay. Now you can see in the upper part of this trigon, there are two holes. What are these holes? Ureteric, vesico-ureteric junctions. Means both the ureters are opening into the trigon. Okay, so this is the trigon, and the apical part of the trigon, this apical part of the trigon forms the internal sphincter. Okay, from here it begins, internal sphincter. So when this internal sphincter passes this, what is this? Urogenital diaphragm. Crosses this, then it forms external sphincter. This external sphincter, there is a outer covering of skeletal muscle, circular skeletal muscle. But detrusor muscle of the urinary bladder, they are not skeletal muscles. Okay, they are smooth muscles. So since it is smooth muscle, we don't have any control over it. Voluntary control over it we don't have. But the muscles, the muscles, here in the where is external sphincter, this is made up of skeletal muscles. Since it is skeletal muscle, we can control it voluntarily. When these muscles are stimulated, they will be constricted and the opening will be blocked. So no urine, as long as it is closed, no urine can come out. We have control over this because we have to find out the time and place for urination. That's why this is being given. When there is no such ability by any means, any abnormality, you will not be able to control there will be incontinence or dribbling of urine. Okay, so these are the detrusor muscles outside covering, and inside is made up of two layers of epithelium. The inside inner epithelium is made up of flat epithelial cells, and outside this towards inside to outside, first layer is flat and the second layer is what? Cuboidal type. Okay. Then muscular coat. Okay, let's see now how they are innervated. They are innervated by autonomic nervous system, mainly the body and the trigon area. Okay, neck area. They are, and also the internal sphincters. Internal sphincters, which part? This part is the internal sphincters. This part. Okay. And this part is controlled by autonomic nervous system. Means sympathetic and parasympathetic nervous system. Here, the function of sympathetic and parasympathetic is different. Why different? In blood vessels, when these smooth muscles are stimulated by the sympathetic nervous system, what happens? There is vasoconstriction. But here we will find relaxation. You have to remember this. So here, the sympathetic nerves will cause relaxation. When they are stimulated, they will cause relaxation of the detrusor muscle. And This internal sphincter, opposite ablet. There it will cause constriction, and in the internal sphincter it will cause relaxation. Opposite. Okay, so this is the function of the sympathetic nervous system here. And the centers for sympathetic nervous system is located in the spinal cord. In L1, L2, T11, T12 segment. T11, in some books you will find only S1 and S2. No, sorry, L1 and L2. Okay. So, they are the centers of sympathetic nervous system. And the nerve is hypoglossal nerve. Okay, hypoglossal nerve. This hypoglossal nerve has both sympathetic, afferent as well as efferent. Through efferent nerves, what is happening in the internal sphincter, what is happening in the detrusor muscles, it will give feedback to the center. Now, according to this, the center will take action through efferent path. Okay, so it is only one thing to do. What to do? Contraction of this muscle, detrusor muscle, and relaxation of the internal sphincter. Okay, now you can understand what will be the function of the parasympathetic nervous system. Just opposite. It will be just opposite. When parasympathetic nervous system located in the S1 and S2, S2, S3 and S4 segment of spinal cord, there lies the center of the parasympathetic nervous system. So from here, the nerves will arise that will be supplying the urinary bladder and the ureters. And what is this nerve? Pelvic nerve. So what is this nerve? Pelvic nerve. So pelvic nerve also having ascending as well as, afferent as well as efferent. So afferent nerve will give sensation to the center, parasympathetic center, what is happening in the urinary bladder. Okay, accordingly it will take action. This action will be done through the efferent path. Okay, and this part, the external sphincter, external sphincter, they are not controlled by sympathetic or parasympathetic nervous system. They are controlled by somatic nervous system. The direction comes from higher center. What are the higher centers that gives direction to the urinary bladder? 3. What are these? One is cerebral cortex. Another is below cerebral cortex, midbrain. Okay, so these two centers actually inhibit, they try to inhibit micturition. So these are inhibitory for micturition. We have to control now. So that's why it is inhibiting. It's inhibiting. And here there is no sympathetic and parasympathetic correction. Okay, another center, pons. Pons has got opposite effect. It can aggravate or it can facilitate urination. Okay, so other two centers are inhibitory and this is facilitatory. Okay, understood? In tabular form or in diagrammatic form, I will explain. So you can see this area, trigone area is smooth, but this area is having gate. Okay? So urethra starts from here, that is coming urethra, and at the beginning there is internal sphincter and here is external sphincter. Innervation. Let us first see the parasympathetic. I said, where are the center? Sector for parasympathetic is S2, S3, S4. Okay, and what are the nerves? Pelvic nerve. Okay, pelvic nerve. And where they will end? Efferent where this muscle, where this efferent fiber will be ending, they will cause contraction of this detrusor muscle. So definitely they will be supplying the detrusor muscle. Also, they will cause, what would be its effect on trigonoria, internal sphincter? Okay. Now the sympathetic. Where is this? Lumbar, 1, 2, 3 segments are the center for sympathetic, and their nerves are, this nerve coming out from here, they will be both afferent as well as efferent, and the nerve is hypoglossal nerve. Okay, they will be supplying this both detrusor as well as internal sphincter. Pudendal means this is a somatic nerve. It is under your control. Whenever you wish, you can create this. Whenever you don't, you can inhibit this. Okay. When you are not liking that urination should not proceed, so then you will be closing the sphincter by contracting the muscles. Can you say this? Sympathetic nervous system, nerves, this is hypogastric nerve. What is its action on the detrusor muscle? Relaxation. What is its action on internal sphincter? Constriction. What is its action on external sphincter? I said the external sphincter is not supplied by any of the autonomic nervous system. It is only supplied by the somatic nervous system. So they don't have nothing to do with the external sphincter. So that's why no innervation. And what is the function of the sympathetic nerves? They help in filling of the bladder. They help in filling of the bladder. Okay. And what is the function will be the parasympathetic? Evacuating. Their function will be opposite evacuation. How? Contraction of this detrusor muscle and relaxation of the internal urethra. Okay. Internal sphincter. Okay. Then only it will open. Come out. At the same time, pudendal voluntarily, I will open the external sphincter. Okay. So in this way, they help urination, these nerves. Now see, the spinal cord, single spinal cord. For better understanding, I divided the part for sympathetic nervous system, for parasympathetic nervous system, and for somatic nervous system. Actually, they are not separate, they are continuous. Okay. So, see, this is sympathetic nervous system, this part is sympathetic nervous system. You can clearly see they are originating from L1, L2, L3, as I said, and the nerves are hypogastric nerve. So this is the hypogastric nerve, and they are, see, this is the efferent nerve, this is the efferent nerve, and this is the efferent nerve. These are the efferent nerve. So here, this is the first order neuron, and this is the second order neuron. The second order neuron ends in the internal sphincter, and the other one is ending in the detrusor muscle of the body. Okay. So this is about the sympathetic nervous system, and as I said, it is hypogastric nerve, and this ganglia, all this nerve passes through this ganglia. This ganglia is called hypogastric ganglia. Okay. So similar ganglia you also get from in this side. It is not shown. In another diagram it is shown. So now we are discussing about parasympathetic nerve system. So here the center is S2, S3, S4, and from here the nerve is coming out and will be supplying the bladder. See, they are supplying this area, that is the trigon area, means internal sphincter area, and they are supplying the body area, means the detrusor muscle. Okay, and they are also having afferent fibers, taking sensation from the detrusor muscles, because detrusor muscles are having receptor. These are called stress receptor. When urine will be entering, volume will rise, pressure will rise, so the wall will be stressed, and because of presence of the stress receptors, there will be generation of impulse. This generation will be going to the center, and the center will do whatever it wants in the reflexly it will be done. Okay. To easy for the thing is not so complicated, very easy here. So if it comes, you can write this. No need of showing the efferent path, only efferent path is shown here. So what are these? Pelvic nerve, this side is parasympathetic side, this is sympathetic side, and this is the somatic side. This is the external sphincter supplied by nerves from S2, S3, S4. These are somatic nerve. They are this area, these valves, they are coating circularly arranged skeletal muscles. When these nerves are contracted, they are stimulated, the muscles will contract and it will close. These spinal centers are under the control of higher centers. They can influence the activity of the spinal centers. Okay. How? What are the centers? As I said, cerebral cortex, midbrain, and pons. See, the direction coming from cortex is inhibitory. Means they will not favor urination. Micturition, they will not favor micturition. Midbrain also same. But pons is facilitated. It will aggravate or it will stimulate. Okay, release it. Everything I already repeated. If you go through this table, you will find what this is what? This is the sympathetic efferent direction is going to the bladder. Efferent. There are efferent from sympathetic, efferent from parasympathetic. So what is the nerve root? T11, 12 and L1, L2, and for parasympathetic 2, S2, S3, S4, and nerves, hypogastric nerve, and for this it is pelvic nerve, and structures, these efferent fibers, what they innervate in the urinary bladder, detrusor muscle and the internal sphincter. Here, parasympathetic nerve, what they supply that same detrusor muscle and internal sphincter. Okay, now the efferent fibers. Okay, sympathetic, they are taking information from the detrusor muscles. Parasympathetic, they are taking information, bringing information from the detrusor muscles. Means stressing. They will give information about the stretching, how much it has been stretched. Okay, and the somatic one, they originate from S2, S3. Efferent originate from S1, S2, S3, S4, and efferent only from S3 and S4. And the nerve is pudic. Sometimes it is called pudendal. Pudic, also it is also called pudendal nerve. Okay, so they supply only the urethra. Okay, what is this? This is nerve, and it is efferent or efferent? Efferent. So this is efferent. Since it is efferent, bringing information whether any urine is passing through the lumen. If it passes, if it finds some urine is coming into the urethra, okay, then it will sense. Immediately you say, urine has started flowing. So now center may either it will inhibit or it will withdraw the inhibition, so that you can urinate. Okay. What are you told? What is the function of the efferent nerve supply of urinary bladder? Either vasoconstriction or not vasoconstriction, contraction of the muscle or relaxation of the muscle based on whether it's sympathetic or parasympathetic. What is the function of the efferent? Now that was they are bringing sensation. This will be contracting or relaxing. Okay, so here somatic in the external sphincter, so there is only efferent they will cause contraction of the skeletal muscles. Physiological capacity of the physiologically how much urine you can accommodate. So beyond that, when urine is entering, you will feel urgency. But if it is time and everything is not possible, then you will start accommodating more in urine, and what is the upward? You will go to anatomical limit, that is 700 to 800 ml. And interestingly, the female capacity of the urinary bladder is higher in male or female? Huh? Male? Female. When we start feeling of urination, when accumulation is about 150 ml, then you will find some either vague sensation or some sensation is, if I try, I can. Suppose we have to travel, okay, let's evacuate it. So that sensation can come. When how much urine is accumulated, this sensation will be starting from accumulation of 150 ml onward. Okay. When a volume of 400 ml or 450 ml or 500 ml is attained, then you will feel urgency. Okay. So when time and place is suitable, then you will urinate. Voluntary control will be drawn, so urine will be coming out. Moreover, detrusor muscle by parasympathetic nervous system, they will be contracted, pressure will be increased, and the sphincter will be released. So urine will come automatically. If in between you can also stop. Already in the process of urination, what happens? Sometimes it happens. Suddenly we have to restrict. So that can also be done by voluntary control. Now let us see the mechanism. Before we start the mechanism, we need to explain this thing. What is this? This is a graphical record. One side, at the x-axis, what is there? Volume. Volume of what? Volume of urine in the urinary bladder. So, when urine starts accumulating there, pressure will be rising. What is the pressure? This is the pressure. This is not the millimeter mercury pressure. This is centimeter water. And in the urinary bladder, it varies from 0 to 40 centimeter water pressure. Okay. When it goes beyond 40, it is not controllable. So maximum pressure you can withstand 40 millimeter centimeter water pressure. Now let us see, we call it cystometrogram. Okay. Cystometrogram. How this graph is produced? Okay. One catheter having two lumen. One catheter having two lumen is inserted through urethra into the bladder. Now the catheter is within the bladder. Through one lumen, we can insert fluid into the bladder. Okay? Controlled amount, sometimes 50 ml, 50, another 50 ml, 100 ml. In this way, we can infuse water into the bladder. And at the same time, we will record what is the pressure. There is another tube. That tube is connected to a pressure measuring device. So whenever certain amount of water is introduced into the bladder, so definitely pressure has to rise. This will be distended, pressure has to rise. What is the pressure? That is recorded. Okay, right. I introduced 150 ml. What is the pressure now? Recorded. Now another, I pushed another 50 ml. What is the pressure now? Recorded. Another 50 ml. In this way, you record up to 450, 500, 600 ml of fluid. And at the same time, when you added 100 ml, what is the pressure? This is the pressure. When you inserted 200 ml, when the fluid is 200 ml, what is the pressure? This is the pressure. So in this way, you recorded it. And one interesting thing you will find. What is this interesting thing? It is that from 100 to 200 to 300 or 400, though your bladder is filling, filling with fluid or urine, the pressure is not rising that much. What happened? Volume is increasing, pressure is to rise, but pressure is not rising. This is the controlling mechanism. This is very nice and it follows Laplace law. What is the Laplace law? It states G by diameter or radius. It says, Laplace says, pressure within a cylinder is inversely proportional to its diameter or radius and directly proportional to tension of the wall. So what will be the pressure? The pressure will be related to this, directly related to this and inversely related to radius or the diameter. If it remains constant, then what is the relationship? 1 by r. That if you increase the diameter of the urinary bladder, pressure will be changed? No. Pressure will not be changed because if you increase the inverse relation, no. Pressure, it will not take because it is, you are dividing this with this. So there will not be any change in pressure. So here also it happens. Increase in volume means diameter of the urinary bladder is increased. Diameter of the bladder is increased, but pressure is not increased. So it is obeying the Laplace equation. So question may come. Explanatory type of question. Isn't it? One explanatory type of question you can expect from here. This is the volume, the pressure within this. So what happened? Some amount of urine has entered into the bladder. So this is the bladder. So I added 50 ml of urine. Volume will increase. So this extra volume will create pressure on it. On the wall. The wall will be stressed and this pressing will be going to where? Either in this parasympathetic center or parasympathetic center. If I want to control the pressure, so what I have to do? I have to expand it. then only pressure will be reduced. So bladder will be expanded. And as a result, what will happen? Pressure will not be increased. So every contraction, there is dilatation followed by contraction. Dilatation and or not dilatation, relaxation followed by contraction. Okay, in this process it continues. When it comes to this level, gradually this contraction is gradually increasing. Then a time will appear when it is not, when this will rise sharply, pressure within the bladder will be rising very sharply. And that means now it is going to be uncontrollable. There will be severe pain, severe urge. Okay, because of this contraction is rising, pressure is rising. So this is cystometrogram. You have to explain. There are three phases. One phase is this. This is the first phase. In the first phase, what happens? Volume was 0, pressure was 0. Then you started increasing the volume, pressure is also rising. But when the pressure came to near about 10 centimeter water, then what happens? Though your volume is rising, pressure is not rising. Volume rising, pressure is not rising. Up to near about 300, 250 to 300 ml. Thereafter, there is no plateau. Phase 2 is over. Now phase 3 starts, then gradually pressure is rising. So this is the phase 3. In phase 2, the system follows Laplace law. Now what is the significance of cystometrogram? In some books it is not there, significance, not written like that. So cystometrogram, what is this? It is the relationship between volume of urine in the bladder and the pressure in the urine. This relationship is expressed here. And anything funny in me? Are you noticing anything funny? Man, constantly you are smiling, no? That's why. Purpose number 1, assessing bladder capacity. If bladder capacity is raised, the frequency of urination will be more. That can be assessed here. What is the capacity of your bladder? Okay. Then compliance. Compliance means, what is the compliance? Distensibility. Okay. So what is the distensibility of this? Sometimes what happens, urinary bladder wall becomes thick, hypertrophic. Those who are suffering from frequent urination, their urinary bladder wall, this one becomes thick. So in that case, compliance is reduced. Distensibility is reduced. Next, evaluating bladder sensation means afferent sensation. Whether it is having proper afferent sensation. Whether it is coming because this, based on this afferent state, reflex will operate. Reflex is operating, will be operating. So this is important. Evaluating bladder sensation, monitoring bladder muscle function. How the detrusor muscle or sphincter is working. So that can be assessed by cystometrogram. And identifying urethral function. If urethra is blocked by means, sometimes calculus, stone is obstructed in the urethra. So in that case, bladder volume will be increased, ureters will be dilated, and pelvic LSL system will also be dilated. So it can be easily diagnosed. Diagnosing urinary problem. Next, evaluating treatment effectiveness. So you got this, evaluated this, then you started medication management, and after 1 week you wanted to see the condition of the patient. So again this has to be done. So if there is improvement, okay, I am going in the right direction. If it is not okay, then you have to change the management. Now the micturition process, how it starts. Let us see, you follow this one. Same thing is there, 3 flowcharts are there. I am advising you to follow this. Okay, so let us start. Okay, feeling of how the process begins, how urination begins, micturition begins. So what will be the filling of urinary bladder and increase in intravesicular pressure. Filling, pressure will rise. So there is filling as well as pressure will be rising. The stimulation, since volume is rising, there will be the stress receptors will be, the wall will be stressed. So stress receptors will be stimulated. Now this impulse has to go to the center. Okay, so transmission of sensory impulse via pelvic nerve to the sacral spinal segments. Sacra means parasympathetic. So it is going to the parasympathetic center. Okay, production of motor. Now reflexive motor sensation, motor instruction is followed. So this motor impulse will travel through the efferent nerve. This means what is the nerve? Name of the nerve for pelvic nerve. So through pelvic nerve it will be coming to the urinary bladder wall and the internal sphincter. Now what it will do? This efferent impulse, contraction of the detrusor muscle and relaxation of the internal sphincter. Contraction of the bladder wall and relaxation of the sphincter. As a result, pressure within the bladder will rise, and since its sphincter is open, urine will start to flow. Okay, so entrance of urine into the urethra and stimulation of stress receptor in the urethra. Okay, so transmission of efferent impulses to spinal cord via pelvic nerve, and it will cause inhibition of the pudendal nerve. So during this period, what happened? Continuously pudendal nerve is constricting the skeletal muscle. Now because of the efferent impulses, there will be inhibition, so it will now relax. So there will be flow, means micturition. Okay, so this way micturiration continues. So you have to describe the procedure with the help of the innervation nerves involved, centers involved, efferent nerves involved. Control, I said, we have higher centers, they can control. So similar effect is made by inhibitory effect made by cerebral cortex and midbrain, and pons is the opposite way. It can facilitate urination, micturition. Now bladder dysfunction. 2 important dysfunctions you have to remember. What are these? One is atonic bladder. Tonic, less tone in the bladder detrusor muscle. It is flaccid. It is very flaccid. So this is atonic. Why it happens? What is the cause? Cause is 2. One is transaction of the spinal cord. Another is infection due to syphilis virus. They destroy. The syphilis infection What is this syphilis infection? STD. So because of the STD, they destroy posterior root. Thus, neurons of the posterior root. So since these neurons are destroyed, no sensation will be coming to the spinal cord. So what is happening in the bladder, that information it will not be getting. Okay, so that is also bladder wall will be always flaccid. No contraction will be there. Okay, so since information is there, it is not there. Okay, atonic bladder. Why it happens? Destruction of sensory nerve fibers from bladder leads to atonic bladder. Okay, there is a lack of stress signals. Bladder is in bladder, urine is accumulating, but stress signal is not going to the center. As a result, urine is coming, no stress is coming, and it will come to its maximum capacity. Then automatically, urine will access urine beyond 600 ml, 700 ml that are entering. They will be coming out as drops, or there will be dribbling. This is called incontinence. Okay, so this is atonic bladder, and when it occurs, two conditions I said. Another is automatic. Atonic, what is the difference between atonic? So I am giving you conditions. Okay, whether it is atonic or automatic. So that's why you have to learn both the abnormalities as well. Okay, so what is automatic bladder? If spinal cord is damaged, okay, then after some time, after some days, the patient will recover. And after recovery, you will find this. What do you find? Spinal shock. Recovery from the spinal shock allows the sacral centers to take over the function of the typical micturition reflex returns. When bladder is full, it automatically is emptied. Automatically, you cannot restrict it because higher center, instruction of the higher center is disconnected. So no control. So when it is full, it will be coming out. It is spontaneous. So this is the difference between the two. What happens? When stimulation of skin is given in the genital region, it will elicit micturition reflex. Okay?